Does anyone want to get out?
My name is Shlok Raykwad, and today I will be talking on the topic of venous drainage of the lower limb. So there are three types of veins which drain the lower limb. The first is the superficial vein, the second is the perforating vein, and the third is the deep vein. The superficial veins are the veins which lie in the superficial fascia. They join to the deep veins. There are two examples of superficial veins. The first is the great saphenous and the second is the short saphenous vein. Now the second type, that are the perforating veins. The perforating veins communicate the superficial vein to the deep veins. The perforating veins are also the ones which are of two types. So the two types of perforating veins are the direct veins and the indirect veins. The direct ones are the ones which communicate the superficial vein directly to the deep vein, while the indirect one communicates the superficial vein via the muscular veins to the deep vein. Finally, we have the deep veins. The deep veins are the ones which have more valves as compared to the other ones. Their examples are the femoral vein, the popliteal vein, and the vena comitantris. So now, let's talk about the veins that drain the lower limb. Starting with the superficial veins, the first one is the great saphenous vein. The great saphenous vein is the longest vein of the body. It basically is formed from the union of the dorsal venous arch. Now exactly the medial end of the dorsal venous arch along with the medial marginal vein of the big toe. This results in commencement of the great saphenous vein. The great saphenous vein further ascends upwards and goes right in front of the medial malleolus, thereby ascending from the medial side of the leg. It goes posteromedially to the knee joint, and as it goes posteromedial to the knee joint, it stays posterior to the patella. Further continuing the medial region, it goes up to the thigh, and finally, before draining into the femoral vein, it pierces the cribriform fascia and the femoral sheath. Now this was the course about the great saphenous vein. Now we'll be talking about the short saphenous vein or the small saphenous vein. The small saphenous vein is formed from the union of the lateral end of the dorsal venous arch along with the lateral vein of the little toe. This results in formation and commencing of the short saphenous vein. The short saphenous vein further goes behind the lateral malleolus, ascends upwards and goes on the lateral edge of the tendocalcaneus. Going and ascending upward in the middle region of the leg, it goes exactly in the middle of the popliteal fossa, finally draining into the popliteal vein. So this is the great saphenous vein. And this one is the short saphenous vein. Now let's talk about the tributaries of the great saphenous vein. Now the first tributary of the great saphenous vein is the medial marginal vein of the big toe itself. So the medial marginal vein of the big toe. The second tributary and the third tributary are present in the leg. One is called as the posterior arch vein, and the other one is called as the just below the knee. It is called as the anterolateral
anterior
vein
leg vein.
Further moving on to the thigh, we have the posteromedial vein of the thigh, and we have the anterolateral vein
Of the thigh.
Now the posteromedial vein of the leg is also called as the accessory saphenous vein. Before piercing the cribriform fascia, the great saphenous vein gives three superficial tributaries. Now from the lateral to the medial side, we'll name them. The lateral most is called as the superficial circumflex iliac. The middle one is called as the superficial epigastric, and the medial most is called as the superficial external pudendal. So the lateral most is the superficial circumflex iliac, the middle one is the superficial epigastric, and finally the medial most is the superficial external pudendal. Now one must also note that there is something called as an external pudendal vein, which is also a tributary of the great saphenous. It drains the region of the perineum. So now let's talk about the deep veins which drain the lower limb. The first being the femoral vein. The femoral vein is the deep vein in which the great saphenous vein terminates. So this is the femoral vein. The second one being the popliteal vein. The popliteal vein is the one in which the small or the short saphenous vein terminates. Now lastly, we have two other deep veins called as the venae comittantis and the other one that is the deep veins of the sole. Now venae comittantis is the vein which accompanies the anterior and posterior tibial arteries, while the deep vein of the sole are the medial and lateral plantar veins of the sole. Now as I have explained before, there are some called as the perforator veins. Perforator veins are the ones which connect the superficial vein to the deep veins. Around 5 to 6 perforators are constant in their position. Naming some, one is the adductor canal or the Hunterian's perforator, situated right here. Now the Hunterian's perforator connects the great saphenous vein to the deep femoral vein. Further, we have the knee perforator or the Boyd's perforator, which is present just below the knee. Now the knee perforator is the one which connects the great saphenous vein to the posterior tibial vein. Now as I said before, the adductor canal perforator and the knee perforator vein. Now let's move on to the other two. They are the medial ankle perforators of Cocket and the lateral ankle perforator. Now the medial ankle perforator are 3 in number. So they are present right here. Now as they are 3 in number, the uppermost is called as the upper medial ankle perforator, the middle medial ankle perforator, and lastly the lower medial ankle perforator. These connect the great saphenous vein with the posterior tibial vein. So these are the medial ankle perforators. And finally, let's talk about the lateral ankle perforator. Now the lateral ankle perforator is present in the posterior end of the leg. The lateral ankle perforator is the one which connects the short saphenous vein with the peroneal vein in the lower third of the leg. So let's talk about the clinical correlation of why we need to know the venous drainage of the lower limb. So the first one being the great saphenous graft. Now what is the great saphenous graft? It is basically a surgical removal of a segment of the great saphenous vein, and an aortocoronary shunt is performed so as to prevent the ischemia occurring on the heart. The second one which we have is the venesection of the great saphenous vein, which is one of the most preferred sites of venesection, as a cannula can be inserted directly right in front of the medial malleolus and IV fluids can be given in cases of emergency. Lastly, we can talk about the thrombosis which occurs in the deep veins and the sodial sinuses. This can result in fatal pulmonary emboli in individuals who have gone through surgery, such as in post-surgical incidences, or in individuals who have a sedentary lifestyle due to sluggish blood flow through the calf bump. So now, lastly, let's talk about the varicose veins. Now, varicose veins are basically veins of the lower limb which become large and tortuous in nature. Now, varicose veins can occur because of two reasons: due to incompetency of the valves in the termination of the superficial veins, or the incompetency of the valves in the perforating veins. There are two types of tests which we can perform to detect where the defect lies. Now, the first is called as the Trendelenburg test, and the second one is called as the Perthes test. Thank you for watching this video. Please don't forget to like, share and comment.